Lori said, I'm Mary Fran Croswell. I'm a child abuse pediatrician with the Prisma Health System here in Greenville. And I'm going to spend a few minutes today talking to you about adverse childhood experiences and the lifelong consequences of trauma. So much of what we know about the effects of childhood trauma comes from a study that was conducted by the Center for Disease Control in Atlanta and Kaiser Permanente, which is a health maintenance organization in California. They published a study in 1998 that investigated the effect of child abuse, neglect, and household challenges and on later life health and well-being. There were more than 17,000 participants in this study, all members of the HMO, who received physical exams and completed a confidential survey regarding childhood experiences and their current health status and behaviors. The 10 adverse childhood events, or what we call ACEs, that were included in the original study were physical, sexual, and emotional abuse, physical and emotional neglect, if a mother was treated violently in the home, if a family member had mental illness, a substance abuse issue, or was in prison, or if the child lost, or if they had lost a parent to separation or divorce. And the findings were really astounding. First, they found that ACEs were incredibly common, even in this subsection of a population. So you remember that all of these 17,000 members of this health maintenance organization had health insurance, which meant that they had a job, and many of them were college educated. But even in that small population, 67% of the adults had at least one ACE, 1 in 5 had more than 3, and 1 in 8 had more than 4. So the next realization from this study was that there was a dose-response relationship between an ACE and adverse health outcome. So an ACE score is based on the number of those events that an individual has experienced. Each additional ACE a person experienced carried a higher risk for the adult health risk behaviors that they assessed. For example, persons who had an ACE score 4 or higher had a 4 to 12-fold increased health risk for alcoholism, drug abuse, depression, and suicide attempt. And this also rolled over into having a graded relationship to the presence of ischemic heart disease or cancer, chronic lung disease. So the bottom line was that there's a biological response to trauma or to toxic stress that can be incredibly destructive and last a lifetime. So in some ways, the effect of this study resulted in a paradigm shift in the way we approach disease from what's wrong with you to what's happened to you. So intuitively, we would expect that the effects of trauma do not wait until adulthood to manifest themselves. And studies have shown that a child who has experienced ACEs is more likely to have learning and behavioral issues and result in getting kicked out of daycares. So what makes stress toxic? The toxic stress that we are describing here is very different from normal healthy stress that a child needs to experience in order to develop healthy coping mechanisms. It's the toxic stress that can lead to long-term impairment. So stress becomes toxic when it's either strong, frequent, or prolonged activation of the body's stress response system in the absence of a buffering protection of a supportive adult relationship. So toxic stress encompasses the physical and emotional responses of a child to events that threaten the life or physical integrity of the child or of someone that they love. It is this out-of-control physiologic arousal that is the hallmark of toxic stress that can incite what is initially an adaptive response to a stressor to ultimately become maladaptive and even destructive. So you've all experienced at some point in your life that fight or flight response, which revs up our neuroendocrine system to get the adrenaline flowing to allow us to both perceive and respond to perceived danger. And this is an adaptive response. But imagine that that response gets initiated and then doesn't get turned off. It's this prolonged activation of the stress response system that can disrupt the development of brain architecture and other organ systems and increase the risk of stress-related disease and cognitive impairment. well into the adult years that have lifelong implications for learning, behavior, health, and adult functioning. So how is that? Well, the brain is not structurally complete at birth, which is nature's way of giving a child the ability to adapt to the specific needs of the environment it is born into. The neuron development and the connections made between these neurons, along with the support system that developed the architecture for growth, continue long after birth. So this structural development is guided by environmental cues. So an infant's brain can adapt to what it sees, hears, and feels. And this proper structural development depends on nurturing, loving, and stimulating environment. We've also known for a long time that optimal development depends on adequate nutrition, along with the absence of toxins such as lead, mercury, alcohol, or drugs, but we can add to this list toxic stress. In addition, most people believe that the DNA we're born with doesn't change and that it determines who we are during our lifetime. And while that's true, the research from epigenetics, which is the study of how social and environmental factors turn our genes on and off, show that toxic stress can actually change how our genes function, which can lead to long-term changes in all parts of our bodies and brains. Early life experiences can trigger epigenetic modifications, therefore altering the brain structure by changing the way the genes function. What's more is that these changes can be transferred from generation to generation. So we also have to look at the effect of trauma on a parent's ability to parent. Adults who have experienced ACEs in their early years can exhibit reduced parenting capacity or maladaptive responses to their children. They also have the diminished ability to respond to normal stressors in a healthy way. So therefore, they can perpetuate the continuing exposure to ACEs across generations, both by their exhibiting the modeling the maladaptive responses, along with transmitting those epigenetic changes to the genome. But fortunately, the story doesn't stop there. There is hope. And first, it's important to note that ACEs do not dictate the future of a child. An ACE score does not dictate the outcome for an individual. And children survive and even thrive despite the trauma in their lives. But the science of toxic stress now leads us to the science of resiliency. And resiliency is the ability of a child to recover and show early and effective adaptation following a potentially traumatic event. For these children, adverse experiences are counterbalanced with protective factors, which have the potential to foster resilience. And several factors that we have identified that are related to promoting this resilience is one, building cognitive capacity, giving a child the ability to focus and problem solve. Encouraging the motivation and ability to learn and engage with the environment, allowing them to adjust to new circumstances. Fostering the ability to regulate emotions and behaviors and control impulses. Building healthy attachment relationships, especially with their parents and caregivers. And to create good outcomes for children, we have to support the adults. In fact, the research is now showing that the presence of supportive relationships is more critical than the absence of ACEs in promoting well-being. And finally, creating supportive environmental systems in the community. Ensuring that the child has access to quality services such as childcare, after-school programs, health care, and mental health services, among others. So if you can think of child development like a balance scale, with one side representing negative outcomes and the other side representing positive outcomes, experiences that result in toxic stress can weigh down those negative outcomes, the exposure to violence, the poverty, maltreatment. But the other side, there are positive influences that can help make significant stress tolerable by supportive relationships, skill-building opportunities, practice in dealing with manageable challenge to tip the scale the other way. So tipping the scale and building resilience can help repair these structural problems and allow a person to bounce back from the trauma or adversity that they have experienced. And that's what a child's haven is working to achieve. Daily, they are working to tip the scale with the services they provide, services to build resiliency. The therapeutic classrooms teach kids to focus and pay attention. They give them the skills to regulate behaviors and emotions. They are providing for mental health needs, supporting families to foster meaningful relationships with their children. And by tipping the scale towards these positive outcomes, we can optimize their development and enable these children not only to adapt, but to thrive.